All right. So thank you all so much for joining this evening. My name is Dr. Corey Cooper, for those of you who I haven't had the opportunity to meet. I am a pharmacist as well. I specialize in helping people use supplements and food to transition off of prescription medications and focus on their blood sugar, and their gut health. So for those of you who haven't met, hello and welcome to this evening's call tonight. So the opportunity that we have tonight is to talk more about supplementation. So you heard me say a little bit about, my goals to help people make that transition from, from having to always constantly rely on prescription medications, because prescription medications in my mind are actually treating, right, a condition, but we also want to focus on prevention. Let's not even get to the place of where we need the treatment. Let's focus on prevention. And that's what I really love supplementation for. And in some cases, supplementation can help support after you already have existing disease. So what we're going to talk about tonight is an extremely important topic related to supplementation and sickle cell disease. And I think what's really important about this is because of the fact that people even from my own personal experience. So I told you I'm a pharmacist. I remember working in the ER when I was in my residency. And the only thing I knew about sickle cell disease is that people were coming in to the clinic, either to the ER or to the clinic, because they needed pain management. And so my only experience in working with sickle cell patients is around this idea of pain. But there's so much more to what sickle cell is, which is why I think it's really important that we have this conversation. And I'm so excited to welcome our guest today, Dr. Lemitra Scott. So I'm going to tell you a little bit about Dr. Scott, who I had the pleasure of meeting a couple of years ago. It hasn't been too long ago. And I'm gonna look at her bio, because I want to make sure I give her flowers, because I think her contributions to sickle cell advocacy have been so transformative, especially for her community, that I really want you all to know who you are joining tonight for this call. So Dr. Scott is the founder and CEO of the nonprofit organization Breaking the Sickle Cell Cycle Foundation Incorporated. And she's also a mother of a child with sickle cell disease. So not only are we hearing from her as a healthcare provider, we're also hearing from her as a caregiver. So in addition to the fact that she's the founder of this particular foundation, she also still works. So she is a director of pharmacy at Tennessee Department of Corrections. So she is a busy mom, caring for her child, as well as also sharing with other people the opportunity so that they can care for others as well. She's been recognized in her community for those contributions. So recognized by the mayor. She's based out of Nashville, Tennessee, recognized by the mayor there. She's been featured in the New York Times. She has been featured on the CDC's website. When you talk about real stories of people living with sickle cell disease, she's been featured there. She has gotten several recognition awards around her contributions to the advocacy of sickle cell awareness from a variety of organizations, both locally as well as nationally. And she, as I mentioned, is a pharmacist. So she got her Doctor of Pharmacy degree from the University of Tennessee, as well as getting a Bachelor's of Science degree from Memphis. So without further ado, I will turn it over to Dr. Scott, and we are excited to hear more about sickle cell.
Well, thank you, Dr. Cooper, for having me join you tonight, and to your followers or the people that you relate to best as it relates to talking about supplementations and vitamins. Oftentimes, when we think about those things, when you go to the store, you see a plethora of options to choose from. And it almost makes you wonder, how in the world am I supposed to know which of these to pick? All you've ever heard was, you should take your vitamins, but which vitamins do you really need to take? And especially as it relates to sickle cell disease, as you stated, people who have sickle cell disease, they do end up in the emergency room quite frequently to help manage an ongoing or active pain crisis. But what we want to happen, as you said early, is to err on the side of prevention. What can we do to help prevent a sickle cell pain crisis from occurring? And for those who may be watching and don't know exactly what sickle cell disease is, I guess I can start there. Sickle cell disease is one of the most common genetic blood disorders that impacts minority and African American communities. it affects the red blood cells because the red blood cell, it doesn't carry oxygen very well because you have inherited a genetic mutation from both of your parents that causes your red blood cells not to be that circular disc shape, but instead to take on that crescent moon shape. And those cells are very hard, they're very sticky, they stick to each other, they stick to your blood vessel walls, they form blockages. And wherever those blockages are formed, that is what causes the pain. In addition to that pain, as you said, sickle cell disease is much more than pain. There is the emotional, mental health aspect of it, but there's also the impacts that it has on your organs. So it causes organ damage, increases the risk for strokes. And unfortunately, it can be associated with causing early mortality just because of the secondary complications that arise as a result of organ damage and organ failure. So that is a space in where we are focusing, even with pharmaceutics that are coming to the market. The focus is on prevention. How do we prevent a pain crisis from occurring? How do we preserve organ function to prevent it from declining, to prevent early mortality? So in a nutshell, that's sickle cell disease. That's the space that we're in. And unfortunately, it is a grave disservice, I feel, that our country has provided for the sickle cell community by way of not having a number of therapeutics to actually treat sickle cell disease. So with that being said, there are relatively about 4 medications on the market to treat sickle cell disease. And unfortunately, 3 of them have come about since 2017. That says a lot. To put it into perspective, sickle cell disease was discovered back in the early 1900s. So if you talk about a genetic condition that was discovered in the early 1900s, and here we are at 2023, and you can count on one hand and not even use all of your fingers for therapeutics that are available, that leads you to believe, and you have to rely more heavily, so I would say, on supplements and vitamins to the best that you can to help manage this condition. So with that being said, I'm very happy to be here and to share a little light on which of those vitamins and supplements can be most beneficial and helpful in sickle cell disease. So did you want to get into your backstory about, your familiarity with sickle cell disease, or do you want to go straight to our supplement section?
Yeah, so I appreciate that information as it relates to sickle cell, because from my perspective, like I said, my experience is really only in the pain management piece. So even keeping up with those recent times of the medications that have been approved for patients, I mean, I'm not as familiar with that, because literally all we were doing was managing their pain. And then, of course, as you mentioned, this is predominantly affecting the minority community. So when you have these minority patients coming in, I did my residency in Mississippi. So in Mississippi, just the demographic of what we were looking at when they were coming into the ER, there was this idea that these people were drug seeking. So so they would say they weren't really even having a pain attack associated with their sickle cell, that it was really, they were just drug seeking and using sickle cell as an excuse. And I think that's probably been the biggest misconception for me when I was managing those patients, was this idea that it's really about drug seekers and not so much that there's truly a pain crisis that patients are experiencing. So I definitely think that as you talk about the different supplements to help prevent that, I probably want to dispel that myth around this idea that these are really, that this is not that it's not painful. I mean, and actually it was funny. This came to light for me when I saw Transformers recently.
Oh,
and
yeah.
I don't know if, so for people who maybe didn't see Transformers, the little boy in the story had sickle cell disease. And I had almost forgotten some of those stories that I had heard when I was in practice around the type of pain that patients experience. So can you describe a little bit what that pain might feel like and why it is so painful? I heard you tell us, why the pain actually occurs, but is it like a nerve pain? Like, what does that pain feel like for patients?
Well, I can tell you this, it's complicated. And it's complicated because you do have areas of the body that are no longer receiving blood because of this blockage. So if you have any area that's not getting what it needs by way of blood that's providing it with its nutrients, then yes, that is going to cause a real pain reaction. But on top of that, you have your nervous system. So most of the times you're under a huge sense of anxiety, you're feeling stressed. All of those hormones are activated within your nervous system. So now when you have those nervous system hormones that are activated, they're actually turning on your nerve impulses that fire out those signals. So now you have a neuropathic component of pain compounded with your traditional pain that you would feel from an autonomic response because you don't have blood perfusion going to a certain area. That is causing pain as well. And as you know, when people say that sickle cell patients are drug seeking, they may not be fully understanding what type of pain the patient is actually feeling at that moment. That piece is critical because oftentimes opioids are the mainstay of managing pain. Anytime a person comes in and they've got severe pain, especially in sickle cell disease, morphine is the mainstay of therapy. Unless, somebody's allergic and they give them something different, but it's still an opiate. Well, when you talk about neuropathic pain, that is not impacted by opiates. So here you are giving a patient an opiate medication. The patient is saying, I'm not experiencing any pain relief. They are still under this extreme stress and anxiety. They still are in a situation where they're in this fight or flight mode because they're in this pain. And yet what you're giving them is not working. You as a healthcare practitioner are looking at them saying, you've got to be lying. I've given you, this astronomical amount of pain medicine and you're saying it's not working. How could it not be working? You're just seeking drugs. And the whole time, the patient has a neuropathic pain problem that is not adequately being treated because opioids only make it worse because the real source of the pain is not being treated. And then you have another compounding factor where people who have sickle cell disease are experiencing pain so frequently that they may become oversensitized to pain. So what may be something that, as light as a feather touch to you, it doesn't bother you not one bit. But for a person who has sickle cell disease, they may be overly sensitized. So now what used to be minor or what could be thought of as minor, now it causes excruciating pain to them. So in that respect is where we have the different aspects of how patients with sickle cell disease oftentimes get labeled as drug seekers because people in the healthcare community don't do, I would say, enough diligence in understanding sickle cell disease and understanding what it takes to treat sickle cell disease.
Yeah, so I appreciate that explanation of the different types of pain, because I know even, when we look at some of the supplements that we use with our supplement line, they target different aspects of pain. And so if you kind of don't understand what a patient or a client might be describing, then you might end up thinking, how could something not be working for you? And when in fact, you've actually just given the wrong support. So tell me, so is that where the supplementation comes in? So is supplementation coming in to actually prevent these pain attacks, or what's the benefit of doing the supplements?
Well, it depends. People who have sickle cell disease, typically they are anemic because they don't have adequate red blood cell supply. So when you think about supplements, you think about supplements that can help your body have what it needs, the building materials necessary to combat anemia. So when you think about anemia, sometimes people may think, oh, their iron is low, so they need to take more iron. In sickle cell disease, that's not necessarily the case that's going on. So the iron levels are typically within normal range. In sickle cell disease, the anemia results because the bone marrow can't keep up with production of those red blood cells that lyse so quickly. So it's not that they don't have they don't have iron around to make the red blood cell. They're just lysing because sickle red blood cells only last you about 14 days. Normally, a red blood cell is supposed to last you about 3 months. So therein lies our first issue. So when we talk about supplementation, you want to talk about supplements that can help increase or boost the ability to even make red blood cells. So that's where folic acid comes into play. Your body requires folic acid, and for a long time, that was recommended early on for kids to start taking the folic acid daily. In the Western diet, most of our cereals and grains are fortified with folic acid, So as long as you're eating your cereals and your grains, you typically get the amount of folic acid that you need from just the regular food that you eat in that regard, and you wouldn't have to take an extra one. But it doesn't hurt you if you took a folic acid daily, or if folic acid was a part of your multivitamin. That would be helpful as well. Outside of doing the folic acid to help with production of red blood cells, most of the times people, they feel very tired because again, they're anemic, you don't have enough red blood cells, your ability to perfuse the muscles and tissues is low. So that's where your B vitamins come into play, because we know B vitamins are important for that energy boost, for, you know, amping up or giving you the gas basically that you need to run your engine, which is your body. So that's where I would say it's not necessarily taking vitamins and supplements to treat sickle cell disease per se, because those particular vitamins are actually utilized to help build up red blood cells and get your energy, because most times people with sickle cell disease are very lethargic. And hold on, before we get too far gone, I'm going to start sharing my screen because I do have a number of vitamins and supplements that I want to make sure that we get through. Oh, let me go back here first to the disclaimer that says the information that we share here is basically for education purposes only. This is not to make any diagnosis for your condition. If you have interest in learning more about these particular vitamins and supplements, it is wise that you reach out to your healthcare practitioner or to your pharmacist to have more of a discussion. Now that that's out of the way, I'll go through these kind of quickly. So in sickle cell disease, again, what our treatment focus, it became important back in the 80s, I will say. It was recognized that people with sickle cell disease were basically, I won't say malnourished, but they didn't receive the right amount of nutrients and supplements that they needed, because their bodies were constantly trying to make more red blood cells. So they were nutrient deficient. When you're nutrient deficient, that leads to delays in growth and development. So sometimes when you see a person with sickle cell disease, they may seem short, or they may seem skinny. And that's, again, it's because decreases in red blood cells, decrease in ability to provide the nutrients and things that your body needs to grow. So that is that's pretty much that's understood well in sickle cell disease. People with sickle cell, they have an increased requirement for protein due to, and energy requirements due to, again, like I said, that chronic breakdown of the red blood cells. And protein metabolism actually consumes about 30% of energy at rest. And recent data indicate that there is a high resting energy expenditure that is determined by the energy needs for cardiac compensation and at increased protein metabolism. So all that says, in sickle cell disease, it forces your heart to work a little bit harder, trying to get that blood through the body, because it doesn't have a lot. And so it's trying to perfuse the body as much as it can. So it's causing your heart to work a little bit harder. So therefore you need more energy and nutrients again to get the gas going. And if you look at the medicine bottle or your multivitamins, when you look at the daily amounts that are required, because people with sickle cell disease have a higher requirement, that regular daily amount is not necessarily what's needed in sickle cell disease, because sickle cell disease people, remember, they have a high rate of metabolism. They have a high rate of resting energy expenditure. That just means if you just sit here in the chair all day and do nothing, the amount of energy that is expended for a person who has sickle cell disease is much higher than a person who doesn't have sickle cell disease. So I think everybody that's in the group here, we already are of the same understanding of knowing what dietary supplements are, so we can skip through that. So when we talk about macronutrients, macro meaning large, so these are the nutrients that your body would need in larger amounts. These are your carbohydrates, proteins, and fats. Those are your three main macronutrient groups. And you do see that there is some overlap when it comes to protein. So you can get proteins from some carbs, and you can also get proteins from some fat. So again, proteins are needed in higher amounts in people who have sickle cell disease. Amino acids are basically the building blocks of protein. So when we talk about supplementation, that's where the supplements will come into play. Arginine supplementation has been reported to improve muscle function and reducing pulmonary hypertension. Pulmonary hypertension is something that is really significant in sickle cell disease, and it's really severe because when pulmonary hypertension, and basically that's the blood pressure that is around your pulmonary and your lungs, the blood vessels that provide blood to your lungs and areas. So in sickle cell disease, there is a huge or a greater development of pulmonary hypertension, and there's not a lot of treatments available for it. So that's why it's one of those severe types of conditions that you want to prevent at all costs, or with sickle cell disease. L-glutamine has been shown to lower the resting energy expenditure and oxidative stress. We'll talk about L-glutamine in just a minute because that's one of those medications that has come to the market in commercial form for sickle cell disease in the past couple of years. So basically, where do you get your proteins from? Of course, you can get them from meat, but you can also get them from eating a variety of plant sources such as beans, lentils, nuts, and seeds, and soy, as well as grains, vegetables, and fruits, which goes to show why that overlap between the carbohydrates and the fats, there was some overlap in where you may be able to get your protein from. So L-glutamine is an amino acid. And a little background here, sickle cells are more susceptible to oxidative damage compared to normal red blood cells. And that means they have a higher rate of oxidative stress. Well, all that means is because sickle cell disease break apart, they're so fragile, the intracellular contents, when that comes out into your bloodstream, all of those things actually start to attack the cells that are around it. This is what causes that oxidative stress. That oxidative stress causes even more cells to start to break apart because they're fragile. Well, when you have L-glutamine on board, it is thought to believe that L-glutamine reduces this oxidative stress. So you would think of it in terms of an antioxidant. This causes the red blood cell to maintain its normal structure and not cause occlusions or blockages, and ultimately decreasing the rate of vaso-occlusive pain episodes. So Indari is the brand name that it goes by. It came to market in about 2017, and it was shown that people who were treated with L-glutamine or Indari, they had resulted in fewer hospitalizations due to sickle cell pain and even fewer cumulative days in the hospital. So even if they ended up going to the hospital, their length of stay was shorter, and they had a lower incidence of acute chest syndrome. So acute chest syndrome is one of the conditions that comes about with sickle cell disease, whereby you get sickle cells in the lungs. It looks like pneumonia on a chest radiograph or x-ray for a person who doesn't have sickle cell disease. And this basically, acute chest syndrome is one of the things that can unfortunately leads to early childhood mortality. So once upon a time, it was observed that kids who had sickle cell disease, they really didn't make it to the age of 5 because they were dying from acute chest syndrome, which is an infection that comes about because of a bacteria. And then that's where penicillin came into play, and being a prophylactic. And kids who took penicillin, they were actually able to make it beyond the age of 5 into early adulthood because they didn't die from acute chest syndrome. So with Indari, those are the benefits that have been seen from it. So what are your food sources for L-glutamine? Protein-rich foods like beef, chicken, and fish, dairy products, vegetables like beans, beets, cabbage, spinach. Beets are good as well for nitric oxide as well. Nitric oxide is a natural vasodilator, meaning it dilates the blood vessels and allows the blood to flow more freely. So some of the things that you eat, they serve double duty. You can get more than one benefit from some of the things that you eat. So then we've got the omega-3 fatty acids. Omega-3 fatty acids, I'll say it in a nutshell, they are anti-aggregatory. So what that means is it decreases the likelihood of the red blood cells forming these blockages, It is an anti-adhesive because I told you that the red blood cells are really sticky. So therefore it prevents them from sticking to each other in the blood vessel walls. It's an anti-inflammatory, which can help with pain, reducing pain. And it also causes vasodilation, again, relaxing those blood vessels to allow blood to flow more freely. There have been some studies that have shown that people who have taken omega-3 fatty acids really had decreases in the number of pain episodes that they had and the number of hospitalizations. So this is definitely one that I would have on board if you're looking at decrease in vaso-occlusion and pain episodes in sickle cell disease. Omega-3 fatty acids is definitely one to have in your arsenal. And I don't know if there are any questions that are coming about, but I just wanted to get through these really quickly. So let me know if we need to stop.
Yeah, so there's a few things that, so sorry to interrupt. There's a few things that that just coming up for me as I'm listening to you. I don't specifically have a question in the chat. I do see feedback, right, of people talking about like, that they are taking the right supplements. They really are paying attention to where they should get supplements from. So I know we've got some stuff on omega-3. Is there, I know we talked about folic acid. Before I kind of ask a question, are we going to talk about more than just those, or?
Yes.
Okay.
Yes.
All right. So let me, so I'll hold one of the questions until we kind of get a little further, and then I'll come back.
Okay. Okay. So again, so as I did this presentation, I wanted to provide supplements that you can go to the store, you can buy it off the shelf. But sometimes people want to know, what do I need to eat? And that's how we started this, using food and supplements to help mitigate issues that people may be experiencing with their conditions. So I try to provide equal balance of where you can find foods to provide you with these things as well. So when you talk about your omega-3 fatty acids, you think about fish, nuts, flaxseed oil, again, yogurt, soy products. That's some of the examples of where you may find omega-3. So omega-3 is the good fat. You don't want trans fats. That's not the fat that you need, but the omega-3 provides your body with good fats because of all of the benefits that I just talked about in the previous slide.
Yeah, I think one thing I will say while we're there is, so it looks like from the food sources that you put up on the screen, it's not just omega-3. It looks like it's like omega-6s are included in that as well. So is it the full spectrum?
It's the full spectrum,
okay.
Right? Because I think in our diet, we don't have a lot of omega-6. So definitely omega-3, you see that all the time. But you do need some of the omega-6 in there, and it may be by way of supplementation because that's just not something that is readily available from our diet. So we talked about the benefits of high protein and how it actually benefits the body in reducing inflammation, oxidative stress, red cell density, and your pain episodes. So now I want to talk about the micronutrients. These are things that are vital to healthy development, but they're actually required in smaller amounts. We talked about the carbohydrates. Those are the things that we need the most of because they're macro. But now we want to talk about the role of micronutrients. These things are not produced in the body, and they must be derived from your diet. So now we've got minerals. I talked about iron deficiency earlier. This is definitely a place where you want to make sure that your labs are checked, because you don't want to take iron when you really don't need iron, because you can run into a situation where you get iron overload. Oftentimes, this is experienced for people who have sickle cell disease and they receive chronic red blood cell transfusions. The iron can build up, and when that iron builds up in the body, it can cause organ damage, cell membrane damage, and hemolysis. So again, be very careful with iron. And when you take a multivitamin, sometimes multivitamins have iron included. Make sure that your multivitamin does not have iron if that's not something that you need supplemented for in your body. And you should definitely be talking with your healthcare provider about your most recent labs to let you know whether or not iron is something that you may need. The next one that we have here is zinc. Zinc deficiency is relatively common in adult patients due to increased urinary excretion, high protein turnover due to hemolysis, and inadequate dietary intake. This significantly increases the daily zinc requirement of sickle cell patients, which is not usually met by normal things that you would eat. So you may be able to tell if there's a zinc deficiency if you have poor ulcer healing. So in sickle cell disease, leg ulcers are very common, and it's very hard for a leg ulcer to heal. So sometimes this may be because you don't have enough zinc in your body. If there is growth retardation, meaning that if a child is growing, but they're not at the regular growth rate of development, then you may want to check to see if their multivitamin contains zinc. Delays in sexual development. In sickle cell disease, this is very common, not just in growth retardation, but just the onset of puberty in sickle cell disease. It's a little later than kids who don't have sickle cell disease. And again, all of this may be associated with decreased dietary supplementation, or they don't have enough dietary micronutrients around. Then you have hyperammonemia. That's when you have high levels of ammonia in your blood. And then you have encephalopathy and immune deficiency. So these are all things that could be relevant because of a zinc deficiency. So zinc supplementation, it actually decreases oxidative stress, decreases the incidence of infection and hospital admission, and it decreases your inflammatory cells. So these are all of the benefits of, how zinc can help. So when we talk about how zinc helps in other areas, it increases your serum testosterone. Again, that plays into that onset of puberty and the hormone activation there, in growth and anti-inflammatory proteins. These benefits suggest that zinc supplementation may be beneficial to sickle cell patients. So again, I wouldn't go and buy just zinc. If I were someone looking to supplement, I would look for a supplement that contains multivitamins and minerals in the amounts that I need and provided these things. Food sources that you can get zinc from. We've got oysters, red meat and poultry provide the majority of zinc in the American diet. Again, here we go with where you may find it, beans and nuts. It seems like we've talked about beans and nuts in every category. So for me, a diet that is rich in these beans and nuts, it seems like you could get a huge bang for your buck when you start thinking about which foods do I need to include in my diet. Whole grains, fortified breakfast cereals, and dairy products. So again, what you have not seen here in any of the slides when we talk about food is anything processed. This is all whole food. This is all natural food. So a diet that is based on natural foods is much, much better for not only people with sickle cell disease, but any person around. The more that you can decrease chemicals that are in your body, the better off you will be. And that is because processed foods contain chemicals that are very inflammatory to the body. And sickle cell disease in itself is already intrinsically inflammatory. So when your condition itself causes inflammation and you're eating foods that cause inflammation, that compounds the issue even more. So whatever you can do to eliminate processed foods, and I know it may be difficult because we're in a microwave society and everything is now, and everybody's so busy. But it may, behoove you to take a little bit of time to look at your diet and what you're putting into your body and how is that manifesting in your disease state. So the next one.
That was one thing I was thinking about throughout the whole presentation so far is this idea of anti-inflammatory. So we need to reduce inflammation. So anything, whether that's macronutrient, your food source, or micronutrient, the supplementation that you might add, the emphasis is on reducing oxidative stress. So reducing inflammation, promoting vasodilation. So it's a theme across whether we're talking about food or whether we're talking about supplementation, that we really are looking at the source being inflammation and the associated stress that causes to your body related to inflammation. So I think that's definitely one thing that I've seen throughout what you've presented so far.
And that is true. That is a common thread. And sometimes, vitamins and minerals, they occur in pairs. So with this copper one here, it follows with zinc. So if your zinc levels are low, your copper levels are usually high. And that creates that oxidative damage in sickle cell disease. So there's a great balance between zinc and copper, because if you have enough zinc, then your copper levels will be low. And then you don't have that high rate of oxidative damage. So then the next one that we have here is magnesium. Low levels of magnesium are associated with increased sickling due to the propensity of the red cell to dehydrate and increases hemoglobin polymerization. So I was remiss because I didn't talk about how the cells got their sickle form when I first started talking. So this slide goes back to, how does the cell even get that crescent sickle shape anyway? It comes about because of dehydration. When the red cell loses its oxygen, that is what begins that sickling process. And if you know anything about our bodies, we need oxygen to live. So that's the main function of your red blood cell, to carry oxygen from the lungs to the body and to all the places that it's needed. So when it drops that oxygen off, it doesn't get back. If it doesn't get back to the lungs fast enough to pick up another oxygen, then that is when that polymerization of that red cell begins, and that is what begins that red cell to change its form until it's able to get oxygen again. So when you have low levels of magnesium, that's also associated with causing increased sickling. It's associated also with anxiety and stress. So again, we talked about what triggers your nervous system in terms of the pain that you experience from sickle cell disease. So again, if you've got anxiety, you've got stress going on, your magnesium levels are low, that it's like this vicious cycle. Again, you're beginning to get this sickling process again. Magnesium helps to bring water back into the cell and to relax and dampen down your stress hormones as it pushes calcium back out and restoring that resting balance. So this is where, again, when we talk about vitamins and minerals occurring in tandem, this is where your calcium and your magnesium come into play. You want to make sure that you have high levels of calcium that keeps your magnesium levels down. I'm sorry. We need magnesium to be up. I'm sorry. So again, you want to have a good balance between the two in your body to decrease, when we know calcium causes your muscles to contract. So again, we want to make sure that we've got this good even keel balance, so you don't have an over propensity to contract, and you don't have an over propensity because of low magnesium to cause red cell dehydration.
Yeah, and I love this image that you just showed, because it really also highlights the importance of hydration in this picture, because we talk a lot about, like, the body's made up of all this water. It's important to drink water, but this also really brings to life a specific example of when you're supplementing with magnesium, how critically important it is that you're also staying hydrated. Because if that magnesium is trying to pull water back into the cell and there's not water available, then you're not able to achieve that balance that you need to with reducing the calcium and reducing the stress hormone. So I think this is like critical. Like, I love this image of really helping people to understand, because we talk a lot about drinking water. We talk, because we use magnesium as one of our supplements. We talk a lot about hydration, and I love how this sort of illustrates the importance of that.
Yeah, it comes full circle when you see, it's like, oh, the aha moment. Water is good for a number of reasons. So when we talk about where do you get magnesium from in your diet, again, we've got our nuts here. We've got some avocado. That's new. We didn't have, I think I may have missed it if we did before. Again, these are all easy ways to get some of the supplements that you need. So you don't always have to rely on one thing or the other, or you're not forced to have to choose between, do I buy a supplement? Do I eat the food? There are a number of things that you can do to put it together to find a way, what works for you, what works best for your lifestyle. I think we've talked about the folic acid ones before. We talked about B vitamins.
Yeah, this is actually where I had a question that I was holding
Oh,
for you, because I know
okay.
we want to give make sure that there's a couple of questions that I want to make sure I ask, and then so that we also keep people on time here, so that
Yeah.
we get some of the questions in. But one of the questions is related to folic acid, and so we
Mhm.
talked you talked about the importance of folic acid, and that deficiency can really contribute to that sort of sickling of the cell. So what about people who don't metabolize folic acid well? Because we recognize that as being more common than once thought. How for those people who are supplementing with folic acid, because you see folic acid on the shelf all the time, but if you can't
Mhm.
metabolize folic acid the same way, what suggestions do you talk to patients about as it relates to alternatives?
Well, there's a difference between folate and then
Hmm.
folic acid. So if
Hmm.
they can't metabolize folic acid, then I would say they may look for a folate instead. That
Okay.
may be one of the workarounds to getting what you needed in regards to folate, folic acid supplementation. Um, I think that may help when you've got an issue with that, because then you don't have to worry about it. It's already in the form that your body needs in order to take it up and use it. So that would be my suggestion.
Yeah, I think that's the key point, right? Is that it's already in the form that your body would need to be able to take it up
Mhm.
and use it. And I think that's a lot of times people don't quite make that distinction when they're seeing folic acid in the, on the shelf, because that's most likely what they're going to see when they're
Mhm.
going into the store trying to purchase a folic acid supplement, is that understanding of what your body actually needs. I think that that's a critical point there. So appreciate that clarification.
And then I would also say you may want to go to a more natural food store that
Hmm.
specializes in things of this nature. Because sometimes what you find at Walmart, not to knock Walmart by any means, but sometimes if you go to a store that specializes in natural products and supplements, you may have more of a variety to choose from if you're looking for something specific to that nature. Okay, so those are the B vitamins. And where you get these B vitamins from, again, your whole grains, your meat, eggs, beans. Again, we've got beans. Again, get you some beans and nuts and you're good. So low levels of A, C, and E, these vitamins are actually needed to protect the cells from oxygen-related damage, and these are what we call your antioxidants. Let me go back to, I don't know, I didn't get to D yet. Okay, so A, C, and E, vitamin C prevents the in vitro Heinz body, which is the denatured hemoglobin formation in sickle cells, and it normalizes hemodynamic changes associated with posture adjustment. So again, these are all things where we talk about what can we do to stabilize the red blood cell. That's what this is all talking about. What can we do to stabilize the red blood cell and allow it to last a little while longer and not to experience hemolysis so quickly. Where you get your antioxidants from, you can get these from your fruits. I would say the ones that are bright and red or dark and blue. Those are good sources of antioxidants. And I don't see beans on here, but we do have some nuts here. So again, you've got
Beans work too. So,
you have a
yeah.
number of places in where you can get your antioxidants from. And then vitamin D supplementation. So we talk about vitamin D in a number of conditions. And vitamin D supplementation, I think, is good for anybody, whether you have sickle cell disease or not, because I think, again, our diets are traditionally made up of a lot of processed foods, a lot of chemicals, and the amount of vitamin D that we need, I think it is truly lacking. But there have been studies that have shown that people who have vitamin D supplementation, they have significant increases in fetal hemoglobin. That is paramount, because fetal hemoglobin is the type of hemoglobin that does not sickle, because it's made up of a different beta chain than the sickle hemoglobin. So in all honesty, one of the medications which is the mainstay of sickle cell type SS, is hydroxyurea. Hydroxyurea has its claim to fame in sickle cell disease because it increases fetal hemoglobin. Fetal hemoglobin doesn't sickle. So now you've got vitamin D, which has been shown to increase fetal hemoglobin. It decreases the high sensitivity C-reactive I can't talk tonight. It decreases high sensitivity C-reactive protein, which is an inflammatory marker, and it reduces the percentage of people who had a high platelet count. So again, people who have vitamin D on board, less likely to have decreases in D on board. So there are two that we have talked about specifically to reduce vaso-occlusion, that is vitamin D and our omega-3. So we talked about two that we know can prevent pain episodes. And this is just in summary. We talked about macronutrients, micronutrients, and these are just basically some resources if you wanted to go and find more information on the things that we talked about. In summary here, we can say that we know that sickle cell patients, they suffer from nutrient deficiencies caused by, again, their increased nutritional needs that are results from the effects of red blood cell hemolysis and increased cell turnover and production. The dietary supplements can help in meeting the additional needs of nutritional needs for sickle cell patients. So basically our overarching theme here, eat a balanced diet that is high in nutrient-rich whole foods, limit your saturated and trans fats, added sugars and sodiums, and keep in mind that when you read labels, high fructose corn syrup, that's sugar. That is highly, highly, highly inflammatory to the system, and it is in almost everything. So it would behoove you to start looking at the back of the labels and being more diligent about the choices that you make in the foods that you consume.
All right, Dr. Scott, we're losing you a little bit there. So it looks like you're frozen for us. So I will give you a second to kind of come back. But in the meantime, I have another question that I want to ask Dr. Scott. So hopefully we can get her back relatively soon. So there she is. You back?
Yeah, so
Okay,
I just
good.
wanted to highlight the part about dehydration. That was the last slide. About dehydration, their kidneys don't concentrate urine very well. And that is one of those intrinsic cyclic things that can actually cause you to be dehydrated, because the disease itself causes you to urinate more, which can increase the risk of having a sickle cell pain episode. So that's why the water is so important. So that's all I've got. I'm open for
Awesome.
any questions about sickle cell disease. I'll leave this for a minute or two with my email.
Yeah, so yes, definitely. If you have other questions about, we can address them, try to address some questions tonight. I said, I know I have one for you. But if you have a question and we can't get to it tonight, then please feel free to reach out to Dr. Scott directly. She has her email address here on the screen. But I have a question. We talked about patients who have sickle cell. What about those who have the sickle cell trait? Because I also heard you say, or when you were talking previously about the fetal hemoglobin, about thalassemia. So I think about beta. So patients who might be already, have a sickle cell trait, beta thalassemia, so another type of hemoglobin disorder for those who may not be familiar with thalassemia. And they're experiencing symptoms. So like, how do people navigate that sort of their experience that's not truly sickle cell, but still might be having symptoms because they carry the trait, and then also have thalassemia?
I would approach it in a similar fashion, because what we talked about is decreasing inflammation, decreasing oxidation, making sure you stay hydrated. that is key. Even with people who have trait, hydration is key, because when we talk about trait, what that means is that the person may, like in my case, I'm a sickle cell trait carrier. I have some sickle cells. I just have enough normal cells where I don't traditionally experience the same symptoms as a person who does have sickle cell would experience. If a person has traits of some sort and they are experiencing complications, I would go back to the same vitamins and supplements that we have talked about here, because we haven't talked about anything that any other person who does not have sickle cell disease. These are all things that any person could take just to have good health. It
Yeah.
just so happens that these particular ones have added benefits when we talk about sickle cell disease.
Yeah, so true. And as we kind of closed on, I think that's one of the things that I think definitely, as I mentioned earlier, that I took from this is the underlying theme of everything that you presented today is also consistent with when we talk about cardiovascular disease, when we talk about diabetes, when we talk about other types of chronic diseases, even in the cases of cancer, or even in the cases of so you mentioned pulmonary hypertension. So hypertension. So there's all these things that we it's like we're always looking for something special for the different things that we might be experiencing, but it really goes back to looking at things in two buckets. You have micronutrients, carbohydrates, proteins, and fats. So what type of whole foods are you eating? How are you eliminating processed food from your diet? That's going to decrease inflammation. That's going to improve vasodilation. That's going to improve oxygenation for your cells. And then you have the supplementation that supports it. So the micronutrient piece that you also spoke to is so providing your body with the supplements that in some cases you're not going to be able to get it from your diet. And so you need the supplementation, but then understanding what that supplement does and what that supplement needs, like in the case of magnesium, you need water. So all these things kind of work together. And so when we talk about drink more water and eat the right things, that they all sort of have an interplay that's really helping to ultimately not only prevent, but in some cases, treat the management of some of these different diseases, chronic diseases that patients experience. So I am so grateful for you coming on tonight and sharing all the information that you have as it relates to sickle cell, both as a healthcare provider, as also as a mom caring for a sickle cell patient. So we definitely appreciate you for what you have shared with us tonight. So if you want to be able to, so for all the attendees, appreciate you for joining and hanging in there with us tonight. And if you want to learn more information or, support the Breaking the Sickle Cell Cycle Foundation, you are able to do that. You have her contact information. And I will turn it over to any final words before we sign off, Dr. Scott.
Well, I just want to say thank you for having me. And I think we may have to do a round two, because all this information is great. But the biggest piece of this is focused on gut health. None of this works if your gut is not able to absorb it. So that's a whole other conversation where we talk about why gut health is important. You got to get your gut together before any of this can work.
I love it. And we will already put that on the schedule. So I'm all about it. So, so thank you all so much for joining, and thank you again. And with that, we will talk to y'all later. The recording will be available if you're interested in that. I will be happy to share, and y'all have a good night. Bye for now.
All right. Thank you. Bye-bye.